what I want to convey. I don't know. There is a complete silence. Someone can say something yes or no, even if you
Yes,
say
ma'am.
it's fair,
Yes, ma'am.
okay? Yeah. Okay, thank you. So then I'll go to the independent sample t-test. So independent sample t-test, like here, whenever you want to compare the mean or median of two groups, and we'll see what are the assumptions that those two groups should be categorical across those two groups. And there are basically we have got this independent sample t-test. So independent sample t-test is to compare two means. If you want to compare two means, but they are not normally distributed, approximately more than they are very much skewed, then your its non-parametric counterpart is the Mann-Whitney U. And if you have to compare the like paired value, so it depends on the study design, how your study design is. Like you are doing, if you are doing any study on pre-post this thing, like you have taken a sample, you have done something pre and then post. Like in your case also, we wanted to take that score PHQ after a week just to show the difference. But since we did not do any intervention or nothing, it was just time. So that's why we recreated that data. Otherwise, we could have taken also the data from you people regarding the post like pre-PHQ and then post-PHQ. So if you want to compare the pre-post, then also it is the comparison of the mean, or it can be comparison of median, depending on whether the data is normally distributed or it is skewed. And if its non-parametric counterpart is the Wilcoxon sign rank test. So non-parametric counterpart of the this independent sample t-test is the Mann-Whitney U, and non-parametric counterpart of this uh, paired sample t-test is the Wilcoxon sign rank. And I remember when we were doing our PGs, we were very it was very difficult for us to remember the names of those tests, like where you will apply Mann-Whitney U, where you will apply Wilcoxon sign rank. Then there was a Wilcoxon test, and there was a Friedman test. So there was many named tests, and our teachers used to ask, like, tell us which test will be applied where. So like it was a very tough task for all of us. But now with Jamovi, you can see, like, on the same interface, even if you don't remember the name of the test, it is very easy, because on that independent sample only, it gives you the option of non-parametric. So no need to remember. At least I was very happy that now, even if you don't remember the names of the test, because it's a cognitive domain, and maybe with as you age, your things to recall things, and remembering names, too much of these complicated things becomes a little difficult. So I was very happy seeing this Jamovi, that now even if you don't remember names, at least you can see the option in Jamovi and you can apply that. So the independent sample t-test is we always say independent sample. So why we are saying this independent sample? Because we now know what are the paired sample and what is an independent sample. So any sample which is not related, and they are not husband and wife or not twins, so that is the independent sample. So since if we come to the basic definition, so it is an independent sample. So because they are two independent groups and they are not the same group or paired sample, they are not related to each other. And t-test, because we are comparing the mean value across two different groups. So what are the different research questions for which we need this? So the one question can be, is average BMI value of population with history of CVD is different from population without history of CVD? Or in if the comparison of pain score on visual analog scale, if you want to compare what will be the mean score after surgical technique 1 versus surgical technique 2. So in first case also, you can see here the one variable is the continuous variable. This average BMI value, it is a continuous variable, and just a second. This is a continuous variable. And if you see this two different population with history and without history. With history and without history. So this is categorical. Again, this pain score on visual analog scale, this is a continuous variable. And you want to see the mean value of this variable in surgical technique 1 and surgical technique 2. So you will go with this independent sample t-test. There's another research question. Like if you want to know whether the medical students who are having a good quality of sleep or do they score high in exam? So you have got a categorical variable like a good quality and a poor quality of sleep, and then you are measuring their marks in the exam as a continuous variable. So in all these three research questions, what have you seen? That there is a continuous variable and you want to see the mean of this value across two categorical variable or two categories of a nominal variable. So for such type of research question, you have to go for this independent sample t-test, which is also known as the unpaired t-test or student t-test. So the other names of this independent sample t-test is the student t-test, between subject t-test, because it's the independent sample, so it is also known as the between subject t-test, or just the opposite of paired t-test, it is also known as the unpaired t-test. So basically three research designs are possible in such type of when you want to apply, or three research designs through which you can apply this independent sample t-test. First is when you want to see the mean difference between the two independent group. So like we have seen, there is a surgical technique 1 and there's a surgical technique 2, and you want to see the pain score after surgery 1 and pain score after surgery 2. So again, you can see because the two groups are independent. The surgical technique 1 and surgical technique 2, they are the independent groups, and you want to see the mean difference of this thing. Like in this example, you can see there are two gender, male and female, and this is a mean cholesterol level. So if you want to see the comparison or the mean difference of cholesterol level between male and female, then you can go for this test. Another type of research design could be when you want to see the mean difference between two interventions. Like you have got, like in case of a randomized control trial, you have got a control group and you have got an intervention group. Like in this case, this is the intervention group and this is control group. So these two groups are independent to each other. Why? Because the person whom you have taken in control, they will not go to the intervention. And then you are comparing the mean cholesterol level. This thing, mean difference between two intervention means if that one intervention is, let's say, exercise training program, another is no intervention. If you want to see the mean cholesterol level between two interventions, then you can do this. Or if you want to know the change between the two interventions. So in the same example, where there is an exercise group and there is a like no intervention group. So before the intervention, you have got some cholesterol level, and after the intervention, you have got some cholesterol level. And this is the difference, means pre-post difference. So if you want to compare the mean of this, means you will take the mean of these values and then mean of these values, because they are representing the change. So if you are doing this, and if you want to compare like where the change is more or less in the two groups, then again you will go for a independent sample t-test. So these are the three research designs which are possible. So what are the assumptions for this? So the first assumption is there is a one dependent variable which is measured on a continuous scale, like we have seen pain score or marks obtained or any other variable. So it is just generally the mean value we always calculate for a continuous variable. So that is known as the dependent variable. So dependent variable is measured in continuous scale, and your independent variable should always have two categories. Because if it is having more than 2 category, then the other test is ANOVA, which we will do tomorrow. So the one independent variable, it generally consists of 2 independent groups. That means it is a dichotomous variable or a binomial variable. And then next assumption is the independence of observation. Means we have to ensure that the individuals are not paired, they are not related to each other in these two groups, and they are independent to each other. Fourth assumption, which is a very important assumption, is that the dependent variable, which is the continuous variable, should be approximately normally distributed for each group of the independent variable. And this we have to check through the assumption. I'll tell you in Jamovi, when we applied this, that assumption is there. But for that, because you have to test it across two groups, you have to go to the descriptive statistics and you have to check that. And then the next is there should not be significant outliers in the two groups of my independent variable in terms of the dependent variable, which I will go. And since I have checked all these variables in the beginning, because remember in the descriptive, I have got the results of all the this box plot and how many outliers in each of these variables. So I have that data with myself, and I have got the data of this normal distribution or not, whether which variables are normally distributed and which are not normally distributed. And then again, there comes a concept of homogeneity of variance. So what is this homogeneity of variance? So basically, we have learned regarding the concept of variance. So we can recall from day one that what is a variance? So basically, variance is we call it as you just calculate the mean value, you measure the difference of the mean with the overall mean, and then you square it. So it is the square, basically square of that difference divided by the n minus 1 is known as the variance. So this is variance of the two group. So what is two groups? So you have withdrawn these samples from two independent populations. So this says that the variance of the population is same from where you are withdrawing these two independent groups. So that is the basic meaning of the homogeneity of variance. Means variance is equal in each group of my independent variable, and that I test using a test which is known as the Levine's test for equality of variance. So again, we have talked about this normality testing, and in normality testing, generally we use the QQ plot or the density plot and histogram, because whenever our sample size is more than 50. And in this case, since our example is 170, so we will go with the QQ plot and the histogram. Then again, for t-test, it is generally said that it is a parametric test, no doubt. But it is a very robust test. And it is not required that should be very strictly normally distributed. So that's why we use a term like approximately normal distributed. Now, how approximately it should be, that is your judgment. Like as a researcher, you can decide. And again, they say that since t-test is robust, even if the data is slightly non-normal, you can still go for a independent sample t-test. The second is, again, it says that if you have got a large sample size, then according to central limit theorem, it says that even a non-normal data can be tested using t-test. And again, a third concept is like if the skew is in same direction, that means if both the groups means I will show all these concepts, whether the direction of the skew is either in positive direction or in negative direction, this test can be applied. So this is an important concept regarding t-test, that although we say that t-test is for non-parametric, you have to apply Mann-Whitney U, but there are situations that even if the data is not normally distributed, but if the direction of the skew is towards the same, or even if it is somewhat approximately normally distributed, or if you have got enough sample size, then even if the data is not non-normal, you can still go for a t-test. Now coming to the concept of the homogeneity of variance. So what it says that the variance in both the population from where the samples have been selected should be equal. So it is tested using the Levine's test of equality of variance. And like Shapiro-Wilk test, here also the null hypothesis says that the variances are equal in two groups. That's why we want our p-value to be more than 0.05. So depending on this homogeneity of variance statistics, we should report the type of t statistics. So Jamovi yields two type of t statistics. One is the normal t statistics. So whenever the Levine's test of equality variance assumption is met, then you will go and report the standard independent sample t-test statistics, its degree of freedom, and p-value. When the p-value of Levine's test of equality of variance is less than 0.05, that means your assumption of equal variances are not met. In that case, you will report the Welsh t statistics. And that option is there in the Jamovi. So you need to click that option, then only it comes. Otherwise, automatically it does not come. So again, to repeat, normality and homogeneity. These two are different concepts. If the data is not normal, then you can go for Mann-Whitney U, or you can still go for independent sample t-test, depending on the amount of non-normal data in your case. But homogeneity of variance, if this assumption is not met, then you have to report the Welsh t rather than the standard t. So what is null hypothesis? So null hypothesis states that the population mean of the two groups are equal, and the alternate hypothesis states that the population mean of the two groups are not equal. And its non-parametric counterpart is the Mann-Whitney U test. So remember a few things in the this independent sample t-test. You have to check for the assumptions. You have to check for the assumption of normality. You have to check for the assumption of homogeneity. And you have to check like there should not be significant outlier. Even if there are outliers, you can just report it. And I'll show how to report it. So this Mann-Whitney U is again, many times there are parameters or variables. Like in Likert scale, you will often see many times it behaves like a non-parametric. Or in our case also, like there were many parameters who were not normal. Like let's say your I think mostly all the quantitative variables except for BMI and systolic blood pressure, it was not normally distributed. So if you want to compare the mean value of an outcome across two categories of a dichotomous variable, and since beginning you know, because you have done the descriptive statistics, so you know already that which are the variables which are not normal. In that case, you can again choose this option of Mann-Whitney U. So again, because independent sample t-test, if the assumptions of independent sample t-test is not met, then you can go ahead with this Mann-Whitney U test. And Mann-Whitney U test is basically, it is used when the assumptions of t-tests are not met. And in case it compares the rank. So what it does basically, all the data, it just gives a rank to it. Like you can say, the lowest value as 1, next highest as 2, and then next highest as 3. So similarly, it ranks those value and it compares the mean rank of a continuous variable. So it is not exactly the log transformation, but it transforms automatically the data into rank, and then it compares those mean rank value across the two groups. So the research questions are same. Here also it is the continuous variable which you are measuring across two independent groups. Like in this case, you can see SGOT level between the alcoholic and non-alcoholic fatty liver disease. So SGOT is it is a dependent variable and it is a dependent continuous variable. and you want to measure its median value or across this non-alcoholic fatty liver and alcoholic fatty liver. Similarly, the post-operative pain, you want to measure the median value as measured by the visual analogous scale in the both surgical technique 1 and surgical technique 2. So these are the two categorical variable, and this is one continuous variable, and you are writing median here. Why? Because it is not normally distributed. And then the next question is the median Apgar score of babies born through the normal vaginal delivery and cesarean section is same or not. So in all such type of research question where you have to compare the median, you will go for a Mann-Whitney U, because in all these cases there is a scale variable in all these research questions, and we want to compare the median of these research questions across the two category of a nominal variable. So the appropriate statistical test is the Mann-Whitney test or the Mann-Whitney U test. So what are the assumptions? The first and most important is whenever the assumptions of t-tests are not met, you will go with the Mann-Whitney U, and here the dependent variable should either be measured on a continuous scale, or even if it is an ordinal, but that ordinal value is more than that level, number of scale is more than 5 or 5 or more than 5, then it can be done. Independent variable should have only two categories, just like t-test, independent sample t-test, and independence of observations. Those are again here, like independence of observation assumptions or the independent variable having two categories. But yes, in this case, you write that dependent variable should not be normally distributed, and distribution should not follow the same shape. So here in this case, you can see this is not normally distributed. So what is the hypothesis? So hypothesis is the median of the two groups are equal, the null hypothesis, and the alternate hypothesis that the median of the two groups are not equal. So we will see what are the various questions, and so this is the question. I have to check the distribution. So basically, I just want to see the mean value of systolic blood pressure, the BMI, and the screen time, because these were the three variables which were normally distributed. So first I'll check that across the gender. So remember, I'll go to this Jamovi. First, I'll check the normality. So for normality, I'll go, there's an option of t-test. So this is the t-test option. If you click on this t-test, you can see there are three options: independent sample t-test, paired sample t-test, and one sample t-test. So we are seeing the one sample t-test now. So when I click this one sample t-test, then you can see there are many dependent variables here, and this is a grouping variable. So right now what I'll do, you can see here the first question is the I have to check the following parameter, the distribution. Distribution means whether they are normal or not. And then I have to compare the mean. So SBP, BMI, and screen time. So you may move more than one variable here, because I have checked these variables are normal. But still, before that, I'll check for the assumptions. But assumptions testing can be checked here also only. So SBP. So this is BMI. This is SBP. And then there is a screen time. And then the grouping variable is gender, because you know that the independent variable should have two categories. So this is the gender. Now coming to first, I'll check for the assumptions. So you can see this is the sections of assumption. So in assumption, you have got homogeneity test and you have got the normality test. So you have to click both because both are having different interpretation. So first I'll click with the normality. So if I check the normality, and in normality, I don't want Shapiro-Wilk. Why? Because Shapiro-Wilk is for sample less than 50. So I'll go for this QQ plot. So if you see this QQ plot, it will give you the same plot which we have done earlier also in the descriptive statistics. So it will take some time, But for independent sample t-test, ideally we should be checking the QQ plot across these two groups. So here you can see, and here you can only test for QQ plot because that option of density plot is not there in the interface of t-test. So by this you can roughly say that yes, they are normally distributed. But t-test, remember for t-test we said that you have to check the distribution across two groups. So what ideally I should be doing, I should go to exploration, I should go to descriptive, and here I have to move this BMI, SBP, and the next was screen time. Screen time per day. And I have to split it by gender. So gender is here, but I want first to check for normality. So what I'll go, and for outlier also, because you need to check the outlier also as one of the assumptions. So I'll first check the density and QQ plot and just see the variables, because I said that you have to check for the across these two groups. So it will give you two graphs per variable because it will show you the normality in males and normal distribution or not normal distribution in females. So like let's see this. You can click on this histogram also. So it will give you a histogram. Picture. Somewhat clear picture. So you see BMI. So BMI, if you see, it is, you can say like it is across these, even if you see this QQ plot and both, you can say that this is approximately normally distributed because this is across this line and this is again across this line. So yes, this is approximately distributed and this gives you both in male and female. So this is the distribution of BMI in female and this is the distribution of BMI in male. So for independent sample t-test, because Jamovi interface in the t-test, it gives you the overall QQ plot. It doesn't break the QQ plot according to gender. So ideally, this should be reported. And then you go and see the other two. So if you see the systolic blood pressure, again you can conclude that these two are normally distributed. And then if you see the screen time per day also, you can say that these are normally distributed. So this first assumption is met. Now you can see the box plot also. So in box plot, you can see what are the outliers because you have to report these, that how many outliers was there in your case. So in case of this, you can see like there was one outlier in male, otherwise there was no outlier in female. If you come down here again, two outlier in male and one in female. So number of outlier are not that significant. Out of 170, if there are one or two or three, that is fair enough. Here, of course, there are outlier more than the previous two categories, but 4 outlier in male and 2 outlier in females. So this you need to report first. Now the next question is what to do with these outliers. So generally it's said that out of 170, if there are 4 and 2 outliers, it does not affect the t-test. But still what you can do, you can include these outliers in your analysis and you can decide whether you will exclude or include these outlier, right? And then you can do that. So this was the outlier and the descriptive. Now coming to the t-test, if you click on this, so it was already clicked above. So I'll go up here. And here what I said that it again gives you one QQ plot, but it gives you overall. It doesn't give you like comparison of male and female. So this was not normality. So we can go ahead with t-test since this is approximately normally distributed across two groups. Coming to the another thing, which is the homogeneity assumption check. So if you click on homogeneity assumption check, you can see here that there appears a table. This is the homogeneity of variance, which is the Levine's test. So if you see the value, so what is the p-value of BMI? It is significant or not significant? All of you please type in the chat box. Is it significant or not significant? Let me see the chat box. Not significant. No, it is significant, right? Yes. So if it is significant, no, Jyoti, it is significant. Means, okay, I don't know what you want to say. So if p-value is significant, my question should be, is the assumption met or not met? I just want that. If the p-value is less than 0.05, what will I call? Is the homogeneity of variance met, assumption or not met? Yes, not met. So if the assumption is not met, what I will click? Which option? Should it be Welch T or student T? Yes. Which T I should report? Welch T. But since I have moved all these three together, so what I need to do now, because the other two, if you see the other two values, the homogeneity of variance assumption is met since the p-value is more than 0.05. And we say that if the p-value is more than 0.05, then the assumption of the homogeneity of variance is met. So what will I do? I'll move these back to main this thing, because for BMI, I need to have this Welch T, and I will uncheck this. So for BMI, I will report this Welch T, which is not significant, this BMI across gender. You can click on this mean difference and the confidence interval of this mean difference. So the mean difference was very less. You can see it was only 0.69. So that's why it was not significant between the BMI. And you can also, and if it is not significant, there's no point clicking on the effect size, because this effect size is the Cohen's d. I will tell you briefly about effect size also. So if the p-value is not significant, you don't have to check for the effect size. Effect size will be checked only when there is a statistical significance. And now you can click on this descriptives. So you can see it also gives you the descriptive means the mean value of BMI here. Then mean value of BMI in male is 24.41 and it is 23.72. So there was a difference of how much you can see here. There was a difference of minus 0.69. Minus 0.69 because what it has done, it has taken female minus male. That's why this value is coming as negative. Female minus male. So since male were having higher BMI, that's why it is in negative, but it is not significant. So this is regarding the BMI, because the normality assumption was met. That's why you could go ahead with the t-test. But the homogeneity assumption was not met. So that's why you went and reported the Welch T. Now you will duplicate this result. Okay, this all, let me delete all this. I will remove this. So this I have like duplicated. And then you can move this here and bring, then SBP and this thing screen time can be moved together. Why? Because they both were normal and the equality of variance assumption was met. So SBP and screen time. I'll move this back to this window, and then you can see this we have seen like equality of variance. This assumption is met. That's why instead of Welsh, I will go with the student t-test value, and I'll report the student t-test value and see. So in case of systolic blood pressure, it is significant. But in case of screen time, it is not significant. Mean difference, you can see there was a mean difference of 7.47 millimeter of mercury between the systolic blood pressure between male and female. And there is a mean difference of 11 minutes per day between screen time of male and female, but this was not significant. So if this SBP is significant, now you have to report the effect size. So the effect size in case of independent sample t-test is the Cohen's d. You can click on the confidence interval also of this Cohen's d, and the effect size is 0.87. So although it was significant, and the effect size is also, it's good, it's 0.87. So, and you can see here that 0.8 is a good effect size. And then these are the this thing. So in such case, how will you report it? So how to write that? So for writing purpose, you have to write the assumptions also, so that you can report it like male and female mean plus minus SD. Its t value and its p value. You can write the number like there were n number of n1 males and n2 females. Mean SBP for both groups were assessed for normality using QQ plot, which showed that the distribution was approximately not normal. Outliers, there was not significant outlier as inspected by the visual inspection of box plot. An independent sample t-test was applied, and there was this thing, and homogeneity of variance. This should have been above. The homogeneity of variance was assessed using Levine's test, because this is assumption. So assumption should be written above, and then after checking assumption, you will go for the independent sample t-test, and then you will report and what is the p-value. So this is how you report the, this is again BMI score across gender. How to report the negative sign. Negative sign is only when it is taking female minus male. That's why negative. This one. But it does not matter, Dr. Tandra. It only says that this value is only negative t statistics or mean difference, because it is taking, if you see the descriptives, just below that you have got this descriptive SBP. So if you see the values here, the male SBP is 123 and the female SBP is 115. So what it is doing, it is like deducting 123 from 115. So that's the only difference. But like Dr. Shamshad is saying, if you want to change it, what I recommend that there's no need. You should understand that since it is only difference, but if you want to change the sign, then like I said, you go to the gender in the variable. So this was the, just a sec, I applied that filter now. Okay, this is not. So this was the gender. Female was above. So like if I will put this male up, then this sign, the same value will be there. But now you can see it has, now all the signs are like positive. If you see the T statistics, because it actually does what Jamovi or any software does, they take alphabetically. So if the female F comes first, if you have not coded it, then it takes it as first. M comes after F, so it will take it as later down. And it always, what it does like initial minus the later. So that's why that negative sign is there. But if you reverse that, you can see now statistics is changed. Initially it was negative, but now it is positive, even the mean difference. But I think you should accept the negative. I mean, it doesn't matter, because you just have to see, even when you report it as such, it is very obvious that the second group, the mean value was higher, and you are giving the descriptive table also here. So this table also, because ultimately you give the value here in the bracket or somewhere in the footnote. So this gives you the mean value. Like here you can see mean in male and mean in female. Okay. Dr. Tandra, is it okay now regarding this negative sign? Okay. Now, Dr. Anindya is asking, what is the interpretation of Levine's test? So, interpretation of Levine's test is whenever the p-value, since the null hypothesis of Levine's test says that the variances of the two groups, because we said that it is an independent sample t-test. So, we assume that from where these samples we have taken from that population, the variances are equal. So, that's why if the p-value of this Levine's test of equality of variance is more than 0.05, then we will say that the null hypothesis is accepted. And that's when we will say that yes, the variances of the two groups from where we have like taken the variances of the population from where these two groups are being sampled, they are equal. So if they are equal, we have to report the student t-test. That means if you see there are two types of t-statistics, there is a student t-statistics and there is a Welch t-statistics. So Welch t-statistics is done when the Levine's test of equality of variance is not met, like we have seen with BMI, because the p-value of Levine's test of equality of variance was less than 0.05. It was 0.03. If you go above, this was the case. If you see the homogeneity of variance of this Levine's test for SBP, since it was less than 0.03, that's why we have reported the Welch T, the statistics of Welch T. And Dr. Shweta is asking, can you repeat the last part? Can you guide me, Dr. Shweta, like last is what in context of what?
Ma'am, I just wanted you to repeat the interpretation of Levine's test.
Okay.
I'm so
So
sorry. I
that
just missed that point and
doesn't matter. Doesn't matter. So remember, we have done the Shapiro-Wilk. And all this p-value is what? Basically, you form the null hypothesis and an alternate hypothesis. Whenever you accept the null hypothesis, it always says that, p-value is more than 0.05. Whenever you reject the null hypothesis and accept the alternate, you say that the p-value is less than 0.05. So usually the p-value is, we want our p-value to be less than 0.05. But because we have framed our null and alternate hypothesis differently, in case of these named tests, when we are checking the assumptions, generally you will find that the null hypothesis is stated in the favorable way. That means in Shapiro-Wilk also we have seen that we want our p-value to be more than 0.05. Why? Because we have said that in the null hypothesis that the data is normally distributed. So the null hypothesis is framed in the way, classically, whosoever has designed these tests, that we want our p-value to be more than 0.05. Similarly, the Equines test, what is this Equines test? This Levine's test of equality of variances. So basically in t-test, what are we doing? We are testing the mean value of a continuous variable. In this case, it is BMI or systolic blood pressure or screen time per day, which is a continuous variable across two independent groups. And that's the name of this test, independent sample t-test. Independent means these two groups are independent to each other. And obviously, what are we doing? So generally, we have learned that through the sample statistics, we want to tell about the population parameter. So we assume that these two samples we have withdrawn from two population. So we assume that those two population variances are equal from where we have withdrawn the sample. In that case only we can report the standard T. Otherwise, we have to report the Welch T. That's what this test says. So Levine's test is the p-value of this Levine's test of equality of variances. If it is more than 0.05, then that means the assumption of equal variances are met. If the p-value is less than 0.05, as in case of, you can see here in BMI, then the assumption of homogeneity, or this homogeneity of variance is not met. Like here in this case. In this case, it is met because it is p-value is. So whenever the p-value is more than 0.05, this assumption, homogeneity assumption, it is met. So if it is met, you will report student t-test. If it is not met, like in case of this SBP, since the value is less than 0.05, which is 0.03, assumption is not met, so you will report this. Instead of this student, which you can see here you can see student, you are not going to click this. This is not applicable here. For this, the Welsh will be applicable. So you have to click this. If the Levine's test of equality of variance is not met. So don't get confused between this normality and homogeneity. These two are different concepts. In case of non-normal, you have to go with Mann-Whitney, like I was saying you, that in the same interface, even if you don't remember the name, this Mann-Whitney test tells that if you please click me, if it is not normal. I don't need to remember whether it was Wilcoxon or it was Friedman or it was what. So it makes your life very easy. You just have to remember the concepts. Even if you don't remember the names, doesn't matter. Right. So that was that concept I was telling you when I was taking the theoretical part of independent sample t-test, that in Jamovi, in SPSS, you have to go searching for this non-parametric Mann-Whitney. That doesn't give you automatically in the same interface. But here it is available in the same interface. Are you guys clear up till this point? But let me tell them the Mann-Whitney also no?
Okay, Mann-Whitney.
No, yes. Matlab, I have not told them the
Paired. Okay, median.
Yes. So let me tell you the exercise of one Mann-Whitney. So let's say the question is median screen time across expense category. So let me see the expense category, and it should be at having two categories. So if I go to the data, this is the monthly expense category. If I see this is having three categories. So I need to make another category. So how I will do it? I will click this and I will click on transform. Why? Because the categories which are here, it is having less than equal to 20,000 and more than 20,000. So first I'll go to transform. I will write monthly expense cat new, because there's already one category. I will set a create new transformation. I will go to this transform 3. I am not naming it right now. I'll click on add recode condition. And then I will click on this. There's a small arrow here. So let me see what is there. Less than equal to 20,000. So I have to use the option of less than equal to. So this is there. And I will come down. This is less than equal to. So less than equal to, I have to type 20,000. And this I will write probably less than or equal to 20K. Else, I will write in single apostrophe more than 20K. So I need to transform this. And then I will click that. So you can see now it has got a category which is having two categories. Now I will go and check its, let's see, It's across, what was the question? I'm always, screen time across 2 category. So I will move this screen time here. So I think in the lower one, there was a screen time. Yes. So screen time is already there. So I'll move this and gender again back. Why? Because for this, I have another grouping variable, which is my expense. So this is my monthly expense new category. So I'll move this here. And then again, you check the this thing. So it is showing here. But again, like I have said, that you have to go to the exploration, descriptive. Here you have to move this screen time. Here you have to split it by monthly expenses. And then see I need to check the histogram density, QQ. So if I come down and see the plots, basically you can see here that it is not normally distributed. So I have decided, now it is up to you again. You can decide that it is approximately normally distributed. So you can take it as a, apply the independent sample t-test also. But for demo purpose, we just wanted to show regarding how to interpret this thing. So I'll again go to the t-test. If I go above, that option will be there. So this is there. Now monthly expense, and now you have to click on the Mann Whitney U. So instead of, and in case of Mann Whitney U, again, there is no need to check for this homogeneity. Because Mann Whitney gives you, it doesn't give you the value. So it okay. So it tells you regarding, although it is here, it is giving you the option and the value, p value also, that we have checked. And this you can see like median. So you have to report this median 180 and 120. And if you come down, you can see the value of Mann Whitney. So the Mann Whitney you can see here that it is significant. The p value is significant. The screen time. There was a mean difference of 50. And in the descriptive, you can see which is the one. So people earning more than 20K are spending less time. If you like see in terms of mean, if you compare median, then the median time is 120 minutes per day in case of people who are earning more than 20, and 180 in people who are earning less than equal to, not earning, who are spending less than equal to 20K. So this is how you interpret your Mann Whitney U. You have to report the Mann Whitney U statistics, which is this statistics. And this is 0.019.
And median.
And you have to report this. And IQR again, you have to go to the descriptive. So like we have, I think when you are checking for the box plot and all, so here you can write. This was for gender. Yes. So here you can, if you go to the statistics, you can click on percentile. You can see the IQR. That means this will be your Q1 and this will be your Q3. So it's 120 only, the Q1. For more these, and it is 300 and 180. You can change its look also if you want it to be like this. So less than equal to this thing. So you can see here. So you can report this 180 in the bracket 120 to 300 and 120 in the bracket 120 to 180. So this you have to go to the descriptive and you have to take the IQR from the descriptive. This Jamovi option of Mann Whitney U doesn't give you the IQR. It only gives you the median value. Is it okay up till this point? Then we can go to the breakout room and we can practice. And then once you are back, then I will cover the paired sample t-test. So just remember before you go to the breakout room, the two tests, Levine's test is for homogeneity of variance. If p-value is more than 0.05, you will report the normal t. If p-value is less than 0.05, you will report the Welch t. If the normality assumption is met, you will go for the t-test. If that is not met, you will go for the Mann Whitney U. Dr. Anand, can you please open the breakout? Is everyone back to the main room? Let me check. Akash, you asked one question regarding effect size. No, actually, I could not. I wanted to take a session on effect size also, but
सेकंड तो इफेक्ट साइज पे खत्म कर सकते हैं लेकर के
मेरे ख्याल में वो बेटर है.
कल पेयर टीचर्स को गड़बड़ा जाएगा जरूरत नहीं
वो एंड द अदर वन नॉर्थ ईस्ट वाला.
नॉर्थ ईस्ट वाला करके खत्म कीजिए ज़्यादा ठीक है कल पेयर करेंगे.
Tomorrow we may ask them to join from 1:30.
हाँ कर सकते हैं कल 1:30 से ज्वाइन करा हो गया आ चुके हैं क्योंकि उसका नाइट ठीक रहेगा पार्टिसिपेंट कल कैसे ना कोई जाना होता है 1:30 ज्वाइन कर लो.
So we all are back to the main room. So I think I wanted to take a session on effect size also. So I'll first take that session on effect size as that is important for this both independent sample t-test and the way we have learned for the chi-square Kramer V. So I think Akash also asked this question like how it is calculated. So basically in case of Mann Whitney U, it is calculated as rank by serial correlation. Like we have said in Kendall-Tau. Remember, I just told you that Kendall-Tau method is also a way of calculate the effect size as well as the this association. Similarly, this rank by serial correlation, that is also a type of correlation coefficient, not like correlation, which compares the rank. Like you just have seen that this non-parametric Mann Whitney U, it assigns a rank to all the values and then it compares. So this basically this rank by serial is a type of effect size which we use in case of a Mann Whitney U. So now what is the effect? What is the effect size basically? So just by an analogy, I just want to make it clear how to interpret the effect size. For every test, the calculation, there are various types of effect size. I'm not going to talk about those like here you are seeing Cohen's D. In case of a chi-square, you have seen phi and Kramer V. If you go to the ANOVA, we'll see there's another name of the effect size, then there's a Hedges G, and then there is a Cohen's D, and so on. So just see this analogy that if I'm trying to compare the price of a cup of coffee across different countries, right? So how will I compare? Because their value of the currency, it's different. So how can we compare? Like in case, if you can see this table, here you can see there are various countries like Japan, France, UK, India, Brazil, Australia, Canada, and Switzerland. And if you see their currency and their value, so Japan is having 400, India is having 120, South Africa 25, South Korea 5,000. So, but that's there in the local currency. To compare, how can I do that? So that standard is what? I will just convert this to dollar. That is the US dollar because that's the standard. So if I have converted these to dollar, you can see now the various prices of these one cup of coffee in different country. It ranges like 2.8, 3.9. And then if you see India, it is 1.4 and so on. So the costliest is in Switzerland probably. It's $5.3 as compared to other country. And I think if you see the cheapest, it is Brazil followed by India. So this is the comparison. And if you apply the same concept to effect size, how we can do that. So if let's say I always talk about this statistical significant difference. So whenever you calculate this confidence interval or p-value, we always talk of statistical difference, clinical significant difference. But for a clinician to practice something, many times if there are two drugs and each showing a statistical significance, but I just want to make sure that which one is better in management of hypertension. So let's say in this example, we are comparing telmisartan versus losartan. And I conducted a study when I gave 50 patients telmisartan versus 50 patients I have given losartan. And I have followed them up at 3 months, and I have seen that the mean reduction, initially at the start of treatment, it was 144. After 3-month follow-up, it is 134. So there is a reduction of how much? There is a mean reduction of 10 millimeter of blood pressure. Whereas in case of losartan, there's a mean reduction of 12 millimeter of mercury. So, is this analysis is sufficient to decide which drug is better for my patients to manage hypertension? Yes? Can you please type in the chat box? No, it is not. And then because you cannot compare. Similarly, a researcher wished to study the effect of a new drug. So a mean difference just by the value, like, because you see the mean difference in SBP is 15 millimeter and mean difference in DBP is 5 millimeter. So can we tell that the new drug has got more effect on SBP as compared to DBP? So the answer is no. Because if you measure the effect size of the mean drug for SBP, although the value is more, effect size is 0.33. If you see the DBP, the reduction is less, but the effect size is more. So the effect size is like, if you take the previous example, mean reduction, and then there's a standard deviation. So what you do, you divide this mean difference with this standard deviation. That is kind of known as the Cohen's d. So this is the Cohen's d. Now we can compare both the two groups. So if you see this value, this is 1.6 and this is 1.5. So if you see which one is better, so definitely, although there is a difference of 0.1 only, but we'll say that telmisartan is better as compared to losartan, and I will go for it. So for a clinical evidence-based medicine, I need the effect size, and like Akash also asked, and I have shown you there in here also. I forgot to tell, but yes, this is the rank by serial is used in case of a Mann-Whitney, right? And if you see the independent sample t-test, there we have seen Cohen's d. Just a sec, let me, yeah, this was the one.
It's okay.
It has gone up probably. Okay, I'll go to another this thing. You can go to t-test, independent sample t-test. And if I just move this gender here, and let's say monthly expenses or systolic blood pressure, because that was normal. So if I move that, I click on this effect size descriptive. And if you click on that, you can see the effect size in case of this thing is a Cohen's d. And this Cohen's d is again the difference in mean divided by standard deviation. So that's how we calculate the this effect size. Now there was another question I think Dr. Nair has asked regarding the Z test of two proportion for north and west. So how to do that? So while you guys were in the breakout room, we were working on that, and I'll just show how to do that. And I think that was a good question because so you go to the data, right? And we have not told you the option of missing values. So what is the best way to do that if you don't want to go back to Excel? So this is the region, okay? And in region, what to do? You can see there's something known as the missing value, okay? let me delete this and I'll select it once again so that you people will come to know. So right now you can see like there are 4 regions, east, north, south and west. And I have to compare like north and south. So how will I do that? There is something known as the missing value. If I put these things as missing value, while analyzing, it will not take these values because it is categorical. So if you want to don't want to take few categorical variable, you can click on this missing value. You can click on this add missing value. And then here when source is equal to, so here you have to select equal to operator and here you can type. So I don't want like west or east. So type according to the spelling and in the single inverted means if E is capital, then you have to type like east. So east is EST. Again, I will add missing value. I'll click on this equal to and I'll type this west. So W is capital because initially I did small, then it was not taking. So west. And then I have just clicked. So you will see that now, if I go and see the variable, it is not taking west and east. It is only taking like north and south. And then you can go and click. And this I have converted, this average daily water intake, because you know how to convert a quantitative variable. More than equal to 2000 and less than 2000 ml per day. So I've just clicked this. I put this region here and I have put this water intake in column. And here, if you see, I have clicked on this Z test of 2 proportion. And of course, you will see this thing, expected count. So before percentage, click on this expected count. Just see, it is 16, 20, 81, 19 and 4.13. So since 3 cells is having more than 5, that means 80% is having. So I will just uncheck this. I'll click this row percentage. And then I'll see the percentage. So percentage, you can see if you see the if I want to compare the more than equal to 2000, so I can write that in case of north, it is 86% people are taking, whereas in south, 71% people are taking more than 2000 ml of water per day, which was not significant. If you see, it is 0.08 with a chi-square value of 1.73. But here the sample size will change because by removing east and west, we have now got 122. So this much is this is how. So by using the missing value in that variable section, you can do this analysis of like north, south, and this proportional difference of water intake in between the 2 regions. Dr. Nair, is it okay? Are
Yes,
you there?
ma'am. Understood, ma'am.
Okay. And thank you, because if you guys ask questions, we also explore. So thank you so much. So I think one option, this thing is still, we could not do this paired sample t-test and Wilcoxon, but I think it's 5:10, so we'll 5:12, so we'll probably start at 1:30 tomorrow, because we always run short of time, and tomorrow also we have not told you McNemer and this thing also.
Risk estimate.
Risk estimate, especially the odds ratio. Although odds ratio, we generally do it by logistic, but still for postgraduate student, you should know in a 2x2 table how you will report the odds ratio. So this McNemer, pair t-test and risk estimate along with ANOVA. So we have got a lot to do tomorrow. So probably, can you guys join at 1:30? We'll post in the WhatsApp group also, so that those of you who have left earlier, they will be updated. Okay, then I think we are ending today's meeting, and we will again meet tomorrow. We'll share the video and the other material like we do every day. Thank you so much, and meet you tomorrow at 1:30.
Thank you.